Digital Healthcare CIO Panel. May I request all of you to please join back. Very interesting session. No hospital will be able to run without CIOs. May I request all of you to please join back. Delegates, those who are standing behind, please join back ASAP. To run a hospital to smart hospital, we need CIOs. Father Bitto, please have a seat. We'll start the session. We need to start the session. Ladies and gentlemen, this session, hospital needs and expectations towards technology and data. Digital transformation in healthcare, a journey into smart hospitals, records and data storage in hospitals and other healthcare providers, generative AI to reshape the future of healthcare. That's the 3-4 topics which we are going to talk now. The entire session is moderated by Mr. Prashant Singh, Senior Associate Director, KPMG. Prashant, may I request Prashant to join us, please. Ladies and gentlemen, please welcome Mr. Prashant. The distinguished panelists in this are Dr. Sushil Kumar Meher, Head IT AIMS Delhi, Mr. Arun Goyal, Director and CIO, Sir Gangaram Hospital, Mr. Praveen B, CIO, Amrita Hospital, Mr. Pushkal Mishra, Chief Information Security Officer, Dr. Path Lab, Mr. Srinivasulu, Tayyam CTO, Arvind Eye Care. So we have a very, mixed panelist in this, which is going to talk, one from Eye Care, one from Path Lab, two from hospitals, 3 from hospital, and a consultant who's going to chair the session. A beautiful session. Without CIOs, as I said, hospital to smart hospital is not possible. So over to the chairman. Sir, thank you. Please, gentlemen, have a seat. Over to you, sir.
Thank you, Shashi. So, good evening, everyone, and welcome to this last session on healthcare service provider needs and expectation towards technology and data. India's healthcare system is a vibrant mix of tradition meeting innovation. India has always been admired for its skilled doctors and specialists.
One minute. Those who are again behind, please make less sound. I've been requesting again with folded hands, please. Your sound should not disturb the panelist. Thank you. Sorry.
Sure, Saji. Thanks. So India has been always admired for its skilled doctors, specialists, both in the public and private sector. And its reputation extends beyond borders. And India has become a hub for medical tourism, attracting patients from across the world, seeking high-quality healthcare and competitive costs. While we've always had a strong foundation in medical expertise, recent years have seen a surge in efforts to make quality care more accessible and affordable. The India government's commitment to a healthier India is evident in groundbreaking initiatives like Pradhan Mantri Jan Arogya Yojana, providing health insurance to about 50 crore people across India. That's covering across approximately about 40% of our population, and they're gaining financial security in healthcare. This scheme is a game changer, providing health insurance coverage to millions of underprivileged citizens. Similarly, CoWIN too had streamlined the entire vaccination process and demonstrated the power of technology in public health emergencies. The ambitious Ayushman Bharat mission is a multi-pronged attack on the healthcare challenges, aiming to establish 1.5 lakh health and wellness centers. And this, coupled with the Ayushman Bharat digital mission in over 2 lakh health facilities, is laying groundwork for a truly connected healthcare system. The health infrastructure mission is another exciting development where we are focusing on strengthening medical colleges and hospitals around the country. These initiatives are not just about brick and mortar. They are more about harnessing the power of technology. New technologies are rapidly transforming the healthcare landscape. And Gen AI healthcare future is right on the cards. Telemedicine is poised to bring specialists closer to remote areas, and medical wearables are empowering patients to take charge of their health. These possibilities are truly game-changing. However, with great power comes great responsibility. And as we embrace these advancements, we must also prioritize robust data security. Cyber attacks is a growing threat, and safeguarding sensitive patient information is paramount. Data privacy is another critical concern area. Ensuring patient trust and ethical use of healthcare data is crucial. And that's precisely why this panel discussion is so important. Today, I have with me a distinguished group of experts who will share their insights on the needs and expectations healthcare providers have from technology and data. We'll learn about their journeys towards becoming smart healthcare providers, explore secure data storage practices, address cybersecurity concerns, and delve into the world of data privacy. And we'll also explore the cutting-edge potential of generative AI in shaping the future of healthcare in India. Now let me start with you, Arun. You've been very much involved with the Ayushman Bharat Digital Mission. You've been a project director there for several years. India's healthcare landscape is vast and diverse, and there's a significant gap between urban and rural healthcare access. I'm curious, in your opinion, how can digital transformation help bridge this gap, especially in the context of ABDM?
Thank you, Prashant. Let me tell you that there were basically 3 building blocks while conceptualizing or creating the National Digital Health Mission, which is renamed later at Ayushman Bharat Digital Mission, was standardization of the healthcare data across the industry, across the healthcare provider. So that was the one mission which we wanted to achieve. To achieve this, we studied all 5 continents, major healthcare programs, and suggested to the government that these standards should be followed up. And I am pretty much confident that the private corporate hospitals are already following those standards when we talk about those. So be it following the ICD-10, ICD-11, be it SNOMED CT, be it LOINC in the laboratories, in the data transmission HL7, FHIR4, R7 form protocol, or other formats in the healthcare. So those were the standards we suggested and imposed into the hospital. We created 3-4 registries which were basic requirements of the NDHM, so that we can make sure that all healthcare providers, be it hospital, diagnostic pathology lab, radiology laboratory, pharmacies across India, nursing homes, and standalone clinicians in the remote areas could get connected to the this network. That was the basic concept of this National Digital Mission. Government wanted that the whole healthcare arena should get integrated with this. So once we have a standardization across the industry, we will be able to achieve interoperability of the data, which government is pushing forward. So initially, government has implemented this particular project in all the union territories, in government hospitals, 100%. So that has been already achieved by the government. Government is struggling to implement it into the corporate world because this particular, one statement is there in this mission is that this is a voluntary mission. So when you say the voluntary, it is up to the people to adopt it or not adopt it. Then there is I personally, when I came out of this particular mission, I see that there is a lack of initiatives from the government side to market this particular project. where government is failing to make corporate understand the value of this particular mission, how patient is going to benefit out of it, how clinical fraternity is going to benefit out of it, how the country and the healthcare policy makers are going to benefit out of it, which is already envisaged out there in the policy document of the National Digital Health Mission. Sorry, I'm saying that National Digital Health Mission, now it is renamed as the ABD and the Ayushman Bharat Digital Mission. Wherein if you have a geographic data, gender-wise data, age-wise data of health tech, then you will be able to implement the health policies in more effective way. Wherein, you know, if you have a pandemic breakup in a particular region, you can control it from the central or the state health government perspective. So that was the idea behind. And particularly one particular concept was kept in mind while implementing and designing this concept was everybody, be it a standalone doctor or it's a nursing home or it's a standalone pharmacy or a chain or a corporate, private, whoever it is, they need not to share the data. They will be the custodian of the main data themselves and they will be the data fiduciary for their data. They need to only share the link of the individual patient's data among the fraternity through respective technical modes, health exchanges, etc. Keeping the cyber security in the consideration where the encryption mode and all the protocols have already been suggested into the document which needs to be followed up. So it is up to the government to make sure that there are incentive scheme or there is some convincing marketing initiative should be there from the government side to make sure that people are adopting it and reaping the benefit out of it for which this particular project was conceived.
Thank you, Arun. Srini, now when Arun talked about, you know, the basics, the policy seems to be pretty, you know, solid and it has a lot of benefits, but, you know, it is not being adopted at the pace at which it should be probably. So are you seeing any regional nuances or any other challenges in adopting this particular policy?
Yes, in fact, you know, prior to this session, we were talking about the kind of challenges why we are struggling to implement. Okay, it's a long way to go because I think the most priority is how we can make, you know, the affordable care to reach to the non-reachable, unreachable people. That is a major. Okay, today I think Sushil sir maybe know, like, you know, today if you take our hospital as an example. I'm from Aravind Eye Hospital. We are world's largest eye hospital. 22,000 patients in a day across 123 facilities. If you come to our hospital, you will see patients are waiting in the queue in the morning 3:30, 4 o'clock. So just imagine kind of a volume, you know, kind of a need. Okay, so I think, see, particularly from Aravind Eye Hospital perspective, we have a very clear vision, you know, how we can eliminate needless blindness. That's our vision. To reach out that vision, what we did, okay, we have two policies. One is design for non-customers. Okay, you design your approach for non-customers. That means you don't think they're customer, you need to reach out to them. Okay, and then develop the competition. So to reach out your vision, so you need to design for non-customer, develop the competition. So what we do, like today we have 123 facilities. If you see the 123 facilities, so tier 1 we have a tertiary hospitals, tier 2 secondary hospitals, tier 3 if you see we have something called a vision center where we are very clear there are 50 villages, there is no hospital around, there is no facility for transportation where we set up the hospital. We make sure that there is no hospital around 50 villages. So reach out to the people where they are not reachable actually. So the ultimate objective is to reach out like your vision.
Accessibility basically.
Yes.
Right.
So I think the fundamental is like one, how you can make it your healthcare is affordable to common man, and how you can make sure reach out to them. So that's a way you'll be able to bridge this gap actually. So that's my view in that perspective. So once we make this happen, then we can build all these things.
Okay. Thank you, Srini.
Prashant, can I add in?
Yeah, sure.
So I heard Srini, his major concern seems to be like, they don't want to fund this particular project because their mission is first to achieve their mission to provide and eradicate blindness out of the society. So government has already taken this into the consideration while designing this particular project, and they have provided all possible applications inbuilt freely available into the project. You need not to spend anything into it. You need to make sure that you standardize the data. You can use the application if you don't have. If you don't have a telemedicine application with you, it is available free into the portal. If you don't have a standardization protocols to standardize your data, they are providing the facility and assistance to you to standardize it. So government is providing all assistance to digitize your things and operations so that you can get integrated with other hospitals.
That's really great to hear, Arun. I think very similar to the Bharat stack that government had promoted.
Yeah,
I think
so,
what you're saying is...
So like e-Sanjeevani and e-hospital is a part of HIS in the project, which any nursing home or any doctor who hesitate to implement the HIS or spend money on the HIS, they can go to the portal and start using it.
Perfect. Let me also ask Praveen. Praveen, can you give us some specific examples from your own experience in your hospital? How technology is helping to improve the patient care and operational efficiency these days? What are you doing to work on that?
Sure. Again, thank you for providing this platform to share some of our ideas based on the experiences and the vast knowledge we have gathered over past years. So just to quickly introduce myself, I'm Praveen and I'm with Amrita Hospital. In Faridabad, we have a 2,700 bedded hospital, one of the largest facility. We're not fully operational, but yes, we've been there for almost 2 years now. And prior to that, we had a hospital in Kochi. So we had an experience of 25 years that we brought up here in Delhi NCR. So in terms of how technology is providing efficiency, not only from the hospital perspective, but also passing on the best possible care to the patient, thereby increasing the efficiency and also reducing the cost. So there are multiple prongs, multiple perspectives that you can look at. So technology has been a very much essential backbone that we have utilized, starting with good EMR implementation, because any new tool, any new technology that you have upcoming, especially the Gen AI that you mentioned, relies purely on having a digital data, a digital source of input data behind it. Unless and until you have that, you could have the best of AI tools and it will do no good to you. So we had this experience earlier of digitizing or having a good EMRs, and that was one of the fundamental that we ensured that we build upon from day one. And we had the advantage because we were opening new, and we had that leverage. Then touching upon the previous question, I also want to point out that in the US, when they were implementing EMR, actually the government, as part of ARA, American Reinvestment Recovery Act, they actually incentivized the physicians, the hospitals, they gave money for the people who are using EMR. And so they had the carrot, and then over years they reduced that incentive, and then finally they started penalizing the physician and the hospitals. And it was well planned out effort. They had different phases of it. So maybe something like that would have helped, because that would give them the incentive for the hospitals and the physician to adopt or become early adopters of it. Coming back to technology, other than the EMR, we are using AI to to bring down the waiting time for the patient. We are using that to reach out to the patient, making sure that we are able to deliver a very personalized, I won't say treatment, but at least a care plan, because we have implemented some of the latest tools that are available. A lot of them are still in the a proof of concept kind of a stage. But yes, I think that is something that will tremendously help, and also technology being very ubiquitous. You know, we could reach out to all the rural area that we're talking about. And with the availability of mobile and the data on the mobile, we could utilize those features, you know, especially in the ophthalmic space. I know that there are a lot of tools that are available where you can use the camera of the mobile to do some of the basic tests automatically. So that will help. Instead of reaching out to the patient physically, that with technology you can also reach out to them. So that was a brief answer.
Thank you, Praveen. Let me turn to you, Dr. Susil. You've been a stalwart in the industry, more than 25 years now?
Yeah, 32 years.
32 years, being in technology. And looking at the technology landscape of one of the premier hospitals in India, can you tell us a little about what are the typical challenges that healthcare service providers are facing in this digital transformation journey?
See, today technology is not an issue. Issue is that how the technology will be implemented, in what way, what place, in what time. Before that, you have to understand very clearly what patient needed for. That has to be. See, the patient footfalls per day in AIMS, already I have told you, this is the 14,000, around 14,000 a day. Total OPD specialized, very unique disease-based clinics, it will be around 600, more than 600 different type of clinics and departments they work in a day. That has to be managed properly. And when the patient, 14,000 patients are coming, with the patient attendance and all these things, if you add it, it is 50,000 people in one building, one place is gathering. When they are gathering, they have to come in a different mode of travel, where they will be parking. Most of the hospitals, whether it's a government or private, it is being challenging that where they will park. Can you solve this to the technology? Because this is the first experience of a patient when he's coming in, that where I have to park or where I have to land. When I have to land at it, I'm not well, I have to walk around 100 meters. Can I walk, or whether you need a wheelchair? And at that time, wheelchair is not available. If somebody can't walk, he needs a stretcher, and stretcher is already been finished, and he has to wait. Where he has to sit? These are the challenges are there. If you can do through the technology to bring them, that no, if you want to come with your car, you can have a parking, you can book at the time of appointment. In that case, it is easy for him. Otherwise, automatically in the appointment will tell that don't come with your car because the parking is full on that day, and you come with your Ola or Uber or Auto, anything else. So this is going to be implemented within a month in our place. That you can book your wheelchair, your stretcher, your parking. Second part is that when you reach there, if you need an attendant, that yes, I can afford it. So one attendant on hearing basis, hourly basis, you will be available to you. These are the facilities. This makes a sense, because when person is coming and he'll find that it is very smooth. Second part is that registration part. Registration part, already it is given to the patient. Patient or patient attendant, they can do the registration from their mobiles. We have the QR code, scan it. If you have ABHA ID, you can give it. Otherwise, create the ABHA ID. You will get the registration number, you get the room number, you will get the doctor's name. Another plus point it is that, let's say your queue number of that room number is 9. And for 9 person means 8 person has to be seen by the doctors, and 9th will come to you. What much time the doctor will see this patient for that 8 patient? It is 1 hour, then he will inform you that you reach around 9 o'clock. After 10, your turn will come. So that 1 hour he may use for the, he can go for a cup of tea in the cafe or somewhere else, he can do it. Third part is that, if you have a particular disease, you are going there, we'll send a, because your mobile is with us, we'll send a link to you that learn this link, that what disease is that and what is the symptom of the disease and what has to be taken care of that. So before going to doctor, you know many things that this disease has this. So which anything is doubt beside that, you can talk to the doctors. So doctor time will go down. So these are the technology leverage you are giving to the patient level to have a good time in AIIMS.
Excellent, Dr. Sushil. I think that will definitely help to improve the patient experience, right? Now, let me change track a little. Pushkal, you being the CISO of one of the large diagnostic centers in India, you know, with this increasing reliance, and we're not talking about medical health records, you know, how do you ensure that, you know, there's a robust cyber security measures around protecting these confidential private records of patients, and also the you know, the business records that as an organization you guys are managing? What are some of the strategies that you're adopting around that?
Absolutely, that's a very pertinent question. Thank you for asking. When you think of a pathology, for an example, Dr. Lal, pathology, we are catering over 1 lakh patient every day when it comes to the diagnostics. Now, that scale obviously cannot be handled with any simplified technology. And obviously, there are 2-3 key elements here. You know, the technology that is generating the data, which is really a clinical information, patient identifying information, as well as the business information. You know, in the same breath, the sales data is equally important. What happens from a board content standpoint is also equally important. So one of the first thing that sort of, you know, goes in terms of designing the cyber framework is really be able to understand that what is confidential and restricted for me in the universe of data that we are collecting. And obviously, when we start from that point, we don't end up putting, let's say, $10 lock on a $5 bicycle. And that's the problem, you know, that most of us grappled with, that how do I make sure that we deliver the, you know, value also when it comes to business risk management. So that's the very first point. How do we identify the, you know, the confidential and restricted informations? Once we have identified it, the another important element that goes with is that, now how do I control the data exfiltration? Now there are 2 actors constantly involved in it. You will have the insider threat as well as the external threat actors who will be motivated to, you know, take the information. Now the insider threat is rather, you know, in the last 5-7 years have been a little difficult to manage, but there are technologies in place that can help you do something called a data leak prevention. And you can do it with the help of, you know, enterprise grade technologies and sort of control the exfiltration across the channels of data. That's the very important point. Now the story doesn't stop when we think of a strategy. We think of a strategy, we think of insider and outsider both, right? And we then think of what is trusted, what is not trusted. Now, most of you, one way or the other, have heard the term called zero trust, right? This is what is sort of, we are also trying to bring into our technology landscape, right? We no longer want to have a sort of implicit trust for the employees or a pathologist or a clinicians, while we have explicit problem with somebody who's trying to access our data from outside. You don't know, you know, which point, you know, the information is going to get, you know, leaked out of. So we look at both the angles. right? For the outside world, what we try to do is we try to create a sophisticated security operations center, right? That is a critical part of our cyber strategy that will actually look at all the information systems. Is there any abnormality going on, right? We all understand that. What is actually a normal behavior in terms of systems that are generating the data, in terms of people that are accessing the data. Now, once we see there is a deviation to an otherwise normal behavior, Security Operations Center is your only option to actually detect and remediate on it. And these abnormalities can be caused by some rogue process, probably getting installed by some ransomware or malware of these days. That's a very important part. So I talked about classification of data. I talked about data leak prevention. I also talk about the importance of Security Operations Center. But the story does not stop here. There are two more important points that actually goes in part of making a robust cyber strategy. The one is really, and this is actually new, there's something called attack surface monitoring. In a course of a business users will reach out to IT for a variety of technological interventions. And IT, being an IT, has to create service and deliver those services to them. And that means huge lot of web applications, that means a lot of mobile applications, that means a lot of services that are publicly accessible also. What are our ways to actually know that my digital footprint outside? The attack surface monitoring is an essential part of, I would say, 21st century cybersecurity strategy to actually know your digital footprint and see what are the loopholes. So you fix them before it gets exploited by the adversaries outside. And last and not least is the end user. Good old end user awareness is a very important part. You do whatever you want to do in terms of spending a lot of money in technologies and creating, let's say, world-class processes. Some user somewhere, is going to sort of succumb to an email or a WhatsApp message, and that will sort of create a lot of issue over the period of time. So that is also a very important element. So it's what I call it a defense in depth. There's no one platform, there's no one process, there's no one technology. It goes on like a defense in depth strategy. That's what we do. And being a healthcare provider, its onus is on us really to be able to see the threats coming from all over the areas.
Great, thank you, Pushkal. I know that all the healthcare service providers are doing their own bit to ensure that the data, the patient data, their own data is being protected and is made available to who needs it. But let me open this question up to the entire group here. According to you, what do you think that the healthcare service providers, along with technology companies, along with government intervention, can do to build further trust and ensure this integrity of the patient data?
Maybe I could take a minute stab on it and then we'll leave it to the forum. See, there is a very famous saying in the world of cyber is a shared responsibility. 10 people, 5 people or 3 people in a one corner of company cannot ensure the cybersecurity. It's a shared responsibility model, and it becomes really a great tool when the power of collaborations actually gets in. When we think about government, we think about certain, right? We depend on certain to actually give us a nice, intelligence when they learn it from our peer group. This is a ransomware that has attacked a certain healthcare. This is a ransomware that has attacked a certain banking system. This is a data breach happening on a certain insurance company, and that's intelligence is very important for us to act on. So that's the very first and foremost important part is the collective collaboration on it. So I think that is the fundamental part, because that is also sort of gives us the ability to generate that stakeholder trust. You can't fight this battle on your own. There's just no way you can find this battle on your own. So the partner also become a very critical ecosystem into this. when it comes to the collaboration. So the common groups are being created now and more and more in terms of healthcare that we can leverage.
Awesome. Praveen, you want to add something to that?
Yeah, so definitely I totally agree with him that, when it comes to cybersecurity, it's a collective, collaboration that can help us, safeguard our data. So we have also been, kind of grappling with this situation. So we have been a little conservative, to be, frank. So we do have most of the data in-house, and but to add to that, we have. So Amrita is also having a university, and we have some, good IT resources. They have created their own SOC, so to speak, and they have done fair bit of development in terms of coming up with the seam and SOAR of our internal teams. So we have kind of gotten their help, and then we have implemented those. So those have helped us in overall. But I totally agree. It's not a easy problem to solve, and also not a very cheap, because there are very expensive solutions in the market if you really want to do end-to-end security of it.
Sure, Dr.
Really, cyber security is a major challenge for every organization already. The eye-opener when it has come, when AIMS has attacked on 23rd November 2022. And government also wake up on that call only, that it is really a threat. And they have started many steps they have taken it. They have installed many honeypots in different locations, and they are observing very closely that what are the threats is coming in which place, where it is coming up. And periodically they are giving the message to other organizations that these are the threats, it is there, be careful. The alertness is coming to the public domains that you have to be careful in this area. But major challenge what I am talking about it. We do not have a single solutions to protect ourselves. There is no single solution is there. Nobody can protect 100% of your data. But you have to be more resilient on this, how to protect yourselves. So you're supposed to make a proper such type of architecture and such type of tools you can put it so that you can recover as fast as possible if the attack has come up. See, not a month back, United Health, it's a very big organization. It has collapsed due to the ransomware attack recently. So they have invested 22% of their IT budget in the IT security, and they failed. So if you talk, I'm spending a lot of money on this and I'm safe. No, it is not safe, basically. And second part is 100% I agree. It is a collaborative and team efforts to do it. It is a journey. It is never ends. Every day you have to learn, and every day you have to alert. I talk to my cybersecurity people. We are around 18 people in the cybersecurity in my team. That be careful when you go home and have a sound sleep at your home. Otherwise, in the morning, what will happen, we do not know. So this is the objective, to take care of it and you work for it, because in the market you will get a lot of tools. And every tool is really important for us, and it is not possible to afford it. So you work in a team, and second part is that what are the vulnerability what you have? It must be communicated to the top management that this is the vulnerability is there, I can't protect it. First thing. Second part is that social engineering. 92% of the attacks through the social engineering. So always you train to the users what to do. And simultaneously the exercise has to be done, because you send the malicious mail to them, how they are reacting, you check each and every user so that you can know what is the status of your users, what they are doing it, and whether they are allowed or not. Third part is that when you are doing these activities, simultaneously you're supposed to have a strong backup programs, just like the concept is 3 to 1, 3 copies, 2 different media, and 1 outstations. This resident program has to be implemented seriously if your data is highly important. Thank you.
I think I agree with your statement. It's everyone's responsibility, but I categorize the whole thing in 3 use cases. One is data privacy, data security, data protection. That's the way I categorize. Data privacy is considering the DPTP Act by the government. Okay, so it is everyone's responsibility to protect the data. So more than a protection, you need to ensure there is something called, you're responsible to, retrieve the data based on the patient's request. So that's something you need to ensure you get the consent, and you need to ensure the data is protected. That is more from the data privacy. Second one is on the data security. So in today's scenario, as Mr. Sushil mentioned, you need to think that you will be attacked anytime. He is already into your territory. You always need to assume that your infrastructure, your data is being under attack. So you need to assume that. So you need to be prepared for it, actually. So that's where the data protection comes. So for that, what we need to do, particularly when we have a peak, let's say on Mondays, you have a huge number of patients. Something happens. What we need to do? So we need to have a clear playbook. Okay, imagine something 11 o'clock on Monday, what happens, what you need to do. Okay, so do we need to switch to the case sheets? Do we need to switch to the alternative cloud? Do we need to switch to the local? These are all the things we need to be prepared. As Sir mentioned, the 3 to 1. Okay, do we have the local backup? See, today the attacks are, it's something like the attacker attacks backup first, more than a main data. So you need to have offline data. That's most important. Even though you keep the data in the cloud, so there will be the traces, you need to ensure you need to have offline data. So we need to be prepared. Okay, if attacker attacks, what we need to do? That's no other way today. Okay, so of course, while for data security, you need to ensure, most important thing is, even the attacker takes the data should not be able to use by him. How you can do that? You encrypt the data. You encrypt the data, even though he takes the data, he will not be able to use the data. You understood, right? So let him take. He will not be able to use. Okay? So the way we need to think, so one is the data privacy. Okay? So when I say data privacy, particularly the consent management or the Data Protection Act, if you go through the data protection, I mean, any violation you need to pay huge penalty. So I think we all need to go through the entire Data Protection Act. It's very neatly well drafted, almost like in a GDPR. Okay, that's the first thing. And the data security, your data encryption is most important. Okay, how you encrypt the data. Third one is data protection. Once happens, how you can retrieve the data. I think these 3 are critical to ensure your hospital and your data, your patient information is protected. Yeah, thank you.
Can I put one? Yeah. Before DPDP, it was another thing which was in the parliament. It is personal data protection bill. In 2018, it has been in the parliament, but that has not been discussed in the group of ministers. Then they have gone through the more details and they have come with the DPDP. But personal protection bill, that when it was there is another draft. It has circulated to the public. It is called DISA. DISA is meant only for the protection of your healthcare records. So right now it is not been approved because they are waiting. The DPP has to be approved and implemented. After that, revise the DISA and they will be implemented for the healthcare.
Thank you, Srini. Brought up very good points. I take a cybersecurity and particularly in the healthcare arena differently. In the health tech or in the cyber world, security has been oversold. I feel so. There is a cybersecurity hype was made. I take it security in three senses. As a CIO, you need to first make sure that your operation doesn't suffer if there is any attack. That should be the first agenda of any CIO, any CISO. Second is, all the responsibilities and the obligations covered under the DPDP acts are covered. Or any compliances if you are working into any MNCs, all the compliances are covered. Those are the second priority. Third is, if your data gets hacked, as he rightly mentioned that it should be encrypted or should not be able to be used by the hackers so that your brand value doesn't get hampered. So these should be the three basic concepts should be there in the mind while addressing the cyber security in the healthcare, particularly in the hospital environment. So far as you mentioned about the UHG, etc., the attacks on that, they have a different type of data where that data can be used into the market for the clinical trial purposes or other purposes and the pharma purposes. But so far as the hospital data is concerned or the patient data is concerned, you need to make sure that these type of objectives are met by any CISO or any CIO.
I think getting back to normal operations and making sure that the data is.
That's why you have to be more resilient. Means what is your business model you have to see. Whether you need a 2 hours downtime or whether you need a 2 minutes of downtime. Based on that infrastructure has to be placed, and that way you have to be more resilient on it.
Yeah, so he rightly mentioned that in case you come across this type of situation, you need to make sure that your BCP is in place, be it manual or other way around. So business continuity plan is there. So those things are the part of operations that if anything happens, be it there is any DDoS attack or any type of data encryption happens, the data gets logged by the hacker or any type of services are getting hampered, you have any BCPs in place so that your business or operation doesn't get impacted in the hospital environment, which when there is a human life is on the stake in the hospital environment. So you need to make sure that should not be impacted, rest follows.
Just to add just one point. Cyber security cost is becoming too high. So now what they expect by 2025, overall cyber security cost is going to be $10 trillion. So, you are talking about zero trust architecture. So being a non-profit organization, from what I always focus, can we do zero cost architecture? So bringing more open source tools like, how we can make it as a zero cost architecture. That's something, because it's becoming, now cyber insurance is becoming another additional expenses.
See, I just add a few points, Prashant, if you allow me. There's always this challenge of putting the business first and then enabling it and then thinking about the cyber, which is, in my opinion, is a right approach. But there are a lot of exceptions and deviation to that. Obviously, there are different businesses who have a different profit obligations. And you rightly said, for a non-profit, we have to be able to stick to the objective first than doing anything else. So, but the thing is that in a course of business, the value of data, whether it is a private hospital, or whether it is a profit-making hospital, whether it is a non-profit making hospital, remains the same. Now, it is always easy to actually get hold of the data when you don't really have much of a control. I suggest in those situations, there's this new focus is being developed. It's called cyber crisis management planning. When you look at cyber, you look at it from identifications, preventions, detections, recovery, response, right? It's the entire cycle. Not everybody can invest the kind of dollars into every phase of it. Once we know that we're not going to put a lot of effort on the prevention, then we'll have to make a balanced choice between what can we do in detections and what can we do in terms of investing right amount of process and training the skill sets to deal with the cyber crisis. Every industry has its relevant cyber threats, right? There are those 5, 7 threats that we all are dealing with. It's not different. And if we can create right playbooks, and like Dr. Sushil said that, business continuity, if we can link this with cyber crisis and identify this is the data loss we are going to incur, and this is the time that we are going to take in the face of adversity, it will give you some respite.
Yeah, simultaneously you have to do whatever the recovery plans. The simulation process supposed to be there, okay, regular basis. Because when the threat has come, again you have to, you have a SOP, you have to follow this one. That SOP will continuous basis, you have to check it, whether you are in the right place or not. That is your most required. And simultaneously, we supposed to give the training that in these cases, how to react. Because in other places, I do not know what it is that when the AIMS has attacked, we are facing the media, we are facing the different agency, 9 agency. 24/7 we are addressing everything. They need the data because, see, the problem is what it is. When the investigation agency is in your place, you have to give the data, and transferring the data from your database, you have a huge database. It takes 3 to 4 days. The 100 gig backbones, from there you are copying it, the data, 9 petabyte of data. What data they needed it, that has to be look into it. So it is a big challenge for that. Simultaneously, the attack is there. Many people, they do not report to the certain. You have to report to the certain, because certain also, they have to learn the type of data has been happened and what way it has been happened, so they can give the alert to other people also.
Within 6 hours, we need to.
Yeah, within 6 hours, yeah. Thank you.
So I think we have a lot of CIOs and CISOs in this panel, so, and cybersecurity is a topic that I think we can go on discussing for days on end, right? So, so let me just kind of change track again. Now, as far as cybersecurity is concerned, we already covered that, but I think Srini spoke about large volumes of patients coming through on a daily basis, and so did Pushkal refer to that. Now that leads to a large volume of data, right? How is all of that data getting managed, and how can some of the cloud technologies and cloud services help to manage the data while at the same time protecting the data and making sure that, you know, the security and accessibility is in place?
Yeah, I think, you know, to manage at a scale, okay, you need to have the right infrastructure, right tools, right processes. Otherwise, it will be a, you know, big nightmare, right? So, the way Aravind, like, you know, for us, the EMR is a very critical thing. Electronic medical record, where just imagine, particularly for the eye care, particularly on the glaucoma patient, where they need to come every 3 months to the hospital. And tracking the history of the patient for the last 5 years. And imagine, like, you know, an average, any person, the health data per year, on an average, it is 80 MB data. For any person, the healthcare data on average per year is 80 MB. Just imagine, you know, 22,000 patients in a day. So kind of a data, bring it into the whole structure mode. So you need to have a right tool and right application. So the EMR is only the option way we will be able to bring this structured data. See, another challenge with the, you know, it is not that, like, you know, I'm making this statement against the doctor. Making doctors to, you know, see, doctors are comfortable writing this prescription rather typing it. So they're not comfortable typing the, you know, diagnostics or advice. That's a bigger challenge for us, actually. So we have been struggling the last few years, like, you know, what we do, like, you know, we give a field level in application, they ignore it. They are comfortable in typing it. But if you type, it will become an unstructured data. Okay, and getting the analysis from the unstructured data, you need to, you know, do a lot of processing. If you have a structured data, it is easy to do analysis. Okay, so that's the evaluation, like, you know, we have been going through it, and it took some time for us to, you know, make doctors understand, because the more you data collect, and you will be able to do more analysis. For example, what we do typically, For every, we have something called cataract QA. So we do a quality analysis we do like almost 50,000 surgeries in a month. So we do the analysis of the surgeries, okay? For example, one surgery takes maximum 3-4 minutes. So what we do, we collect the data. If any surgery takes more than 5 minutes, then we'll get into the detail why this is taking more than 5 minutes. Is it a doctor issue? Is it an equipment issue? Or is it an issue with the patient? So we do the analysis and improve the overall efficiency over the period of time. So that's where the data helps a lot. Okay. So to answer your question, to manage the data, first you need to have an EMR. Without an EMR, unfortunately, if you see like in India, not even less than 10% hospitals have a EMR. Okay. So most of the hospitals got a IHMS. Okay, but the EMR will be able to help improve the diagnostics, improve the patient care, improve the patient safety. That's the most important thing. See, typically, when the patient comes, what we do, the doctor asks the previous history. Let's say the patient visits like 50-60 visits. If he needs to go through the 50-60 visits, it's impractical. Imagine you bring the entire summary of the 50 visits in one dashboard. It becomes easy for any doctor. It becomes easy for any doctor to go through the summary, give the medication. Okay, so that is one help. Today, the EMRs are changing as a clinical decision support system. When I say clinical decision support system, when the patient complains, understand the patient problem, looking into the patient history, parameter, the EMR provides a recommendation. So the doctor can spend efficient time with the patient rather going through the records. So that's the intelligence what you bring in the EMR. So because of the data, what you have in the EMR, because the way the data has been structured, so these are all, you can bring the intelligence within the system. So that the doctor will be able to give her efficiency in his advice or whatever the medication. So one is, getting the data, making the structure of the data, then managing the data. So the managing the data, typically what, see, typical healthcare, there are 3 kinds of healthcare, the characteristics. So in any new technology, you see like, most of the times bankings are first place to utilize. But healthcare, typically what we see like, technology gets matured, then we'll implement the healthcare. That's the kind of an attitude in healthcare. So, but again in healthcare, you have one set of people, they always look forward the technology. Second set of people, let's see other healthcare providers are using, let's learn from their lessons from them, then we'll implement. Third one, they'll never go for any new technology. Okay. So, the technology implementation in the, today it is inevitable, not like in the past. That's the way what we did, we have moved everything to the cloud. See, because imagine like 120 hospitals managing it, it is going to be a nightmare. So what we did, we moved the entire into the cloud. Now we have any place from any time we'll be able to access the data. And most importantly, the resources. So resources, what we can do, let's say on Mondays and Saturdays, I need to have more computing power. What I do, on Sunday night, I increase the CPU computing power. And the Monday night, I will decrease the computing power. So in that way, I manage the resources based on the demand. I don't need to have the entire infrastructure on premises, so that I save the cost. Okay, so in that way, you have a flexibility to use the technology to manage your data, you manage the resources. That's what I would say.
Pushkar, you want to add something to that? Yeah.
I think in this time and age, having more data and the companies having to manage it should not be a problem. The reason being, the cost of data retention is not that exorbitant what it used to be, let's say 10 years before. More data is good, but irrelevant data is not good. In my past experience as an IT guy, and now that being from a cyber standpoint, every data comes with the liability of managing it, right? So unless there are retention requirement or business requirement, we should not really keep the data longer than what it required for, and that's where you build the data retention life cycles. Now, if we don't have a data retention life cycle, we get in this situation where we don't know what data to keep, what data to get rid of. But like Mr. Shivanaslu said, that in the advent of cloud computing, you can take this call, how to actually slice and dice and how to, when to use high computing, low computing, and so on and so forth. But by all means, you collect the data that you need it, which is in line with the purpose for which you have collected that data. This problem will not be, as we go forward. Long-term retentions also, there are cheaper ways to actually retain them. Whether you go for cloud services or whether you want to have an in-house way of retaining it longer, it's manageable. What is not manageable is the liabilities that are associated with the data. And those liabilities have to be worked out. In my opinion, it's the liability that needs to be think through. It's always easy to collect and retain.
All right, so let me ask you this. We are, like Srini mentioned, this vast amount of data. You are saying that the liability is more important than the volume of the data itself as the costs are coming down, etc. What about standardization of data and interoperability? Again, we started with the ABDM mission. That's to connect or have the client data, the patient data accessible anywhere that the patient is going into. How is the interoperability being worked upon as far as data is concerned? Are you guys looking at some standardizations? What is happening on that front?
Of course, I think without standardization, it's going to be difficult. Imagine you get the data from PACS, you get the data from the EMR, you get the data from the wearable device. So to speak all these things, we need to. In that way, ABDM, the team is helping a lot. Kind of bring the standardization so that a doctor can see in one place, end-to-end data in one place from the EMR. And the EMR can speak to the all application. So typically, we use an HL7. Now we are transforming towards FIR, FIHIR. So that way, EMR can speak to other applications, and doctor will be having a complete landscape of the data. So without standard, it is going to be difficult, actually.
Absolutely. And that brings me to the next area. Now, everyone is talking about AI, and especially generative AI, right? And that's having exciting possibilities in drug discovery to personalized medicines. Now, with all of this structured, unstructured data that you're talking about, how mature are your data models in place to leverage this new technology? And how is this generative AI being leveraged by you as service providers? Can you talk about some of these standard use cases that you are coming out with and leveraging this new technology?
So let me take a stab at this. Generative AI is probably slightly new construct, but a traditional machine learning has been there for quite some time, right? And for us to be able to make sense of data and find new revenue streams or improve the process, those decisions have been something that the organizations have been working. What is good at this point is that with the advent of cloud, the information processing has gotten down. The cost of information processing has gotten down. Instead of speaking what is specifically we are doing, but what I've been seeing is there is now a rather easier way to integrate your multiple data sources to a data lake, right? And from data lake, you actually creating the data warehouses, running the analytics on it, and creating a whole sorts of dashboards and the outcomes for the business to take decision on. So those are some good initiatives. I think the medical or the clinician side of it is going to be benefited by that. In addition to our core business processes, which is the traditional finance, marketing, sales, which will also leverage on it to find new sales and marketing opportunity. But I guess these new interventions in the clinical side is what, at least I've been saying last 5 to 7 years, a lot more developments are happening, right? We talk about machine learning. with the help of large language models, there are certain models are being built which have a promise to outperform the pathologist. Now, if they become mainstream, wouldn't that be good from an overall patient journey standpoint? Ultimately, all of this makes sense when we look at patient, how quickly he can know about the disease or she can know about the disease and learn about the right treatment. This is the distance that is pretty huge these days. And that's the distance we all are trying to shorten over the period of time. I think machine learning and its right implementation in the clinical side is the one that is most poised to reduce it.
Right now, AI is playing a major role in the healthcare. Everybody they are saying it. Recently, we have launched another iOncology.ai. It is in the public domain, so anybody they can use it for this. This project has taken about 4.5 years. Why this is? See, other than your healthcare domains, if you are using the machine learning, that is fine because data may not be that much of clean or complete. That can some extent will help you out. But in healthcare, if the prediction is 99%, and can you rely the whole things on that product? No, it will not allow you. Because a cleaning process, it is a very challenging process. Okay, challenging process in the sense, let's take one cancer patient, he has the adenocarcinoma and the cancer is upper stomach and the tumor has been detected from the your PET scan as well as CT. Is the document, this data is sufficient? Let's take, he has a pain. In clinical information, he has a pain in the stomach. The doctor has written on the file or EMR that he has a pain on the upper stomach. But pain has more than 1200 pains in the stomach. Which type of pain it is? That is not mentioned. Means measure of the EMR record is not complete. Why I am saying? When we have developed this model, at that times we have gone through the whole files and we have rewritten it, that which is not written by the doctor. Means the medical record is not complete. If the medical record is not complete, when you will put the machine learning, the machines how it learn, it do not have any intelligence. So that's why in the health sector, totally dependent on any ChatGPT or OpenAI, I'll not agree it because I have gone through the whole services. See, the cleaning process I'm talking about. Whatever data in different sources is, you import it, then merge all the data sets. Next one is rebuilding the missing data. Another is standardize the data if all the records is not standardized. Then you have to normalize it. Another one is any duplication is there, again you have to work on it. Then verification and enlargement, that has to be follow it. Then export the data to a data lake and do it. No one is doing this sort of things, frankly speaking. Anybody has done it, you can tell us. And that's why for 12,000 patient records for the build up a iOncology to AI, it has taken 4.5 years. And 18 specialized doctors, they are involved to clean the data, complete the data. So it is a big exercise which yet very few people they have tried on it. So my perceptions, you can say my understanding is that if you're using any AI tools, it should not be dependent totally on that. Slowly what it happens, so small example I'm giving you. We have given to a users to use the registration process, and he has done the registration that one very VIP person has come to us, and the registration has been done. He is from Madhya Pradesh. Then when the state has come, he has written M, means it has got a Madhya Pradesh, Manipur, Maharashtra, but he has to enter Maharashtra. Because the user is more confident to the system that it is accurate, but he has not verified it. What happens when you use this type of tools, अगेन विल से अरे ये मॉडल तो अच्छा काम कर रहा है, कोई प्रॉब्लम नहीं है, मुझे बाकी देखने की ज़रूरत नहीं है. This is the concept which come up. So that's why when you are using the tools, that it will be used in such a place that it should not hamper. People used to not to be dependent on that tools. Hi. In one tools I am talking about it. When the patient is doing the registration process, appointment process to a department, we have using a one bot to it, AI-based bot. Because 32% of the patients are going to a wrong department. And when we have used the bot, it has gone down to the 10%. In that case, it is acceptable. Because 10% it has been reduced. So this is my suggestion. Any tools in AI you are using it for the healthcare, it should not be dependent. That is my suggestion.
Just a 10-second response to that. That's why we have a concept called responsible AI. So I think that's what is the one way to sort of give us a sense what makes sense in terms of using the right model or not. I think it's pretty much like how you started working on cloud. It's pretty much how you started working on new age data analytics platforms. So it starts with skepticism, but if you have a sort of a way to deal with it, the sky is the limit.
I think the confidence on the data model, on the model itself, as well as ensuring, thorough testing to ensure that the models are not hallucinating, needs to be done before they are kind of rolled out. Of course, of course. I think let me kind of end this by asking you a futuristic question. Do you believe that in the future, with all of this AI, Gen AI technologies coming up, do you think that the technology can become the first point of contact for patients and can, to an extent, and I don't know what is the extent of that, but to an extent, can it even go on to replace, the initial doctor-patient interface as well?
Absolutely, that is going to happen actually. So that is going to happen. So, in fact, like last week we were presenting one of the AI, what we did, we have taken an image from the Google. We gave that image to the AI algorithm, LLM, and it gave very clear, conservative medication, optimized. So kind of, the doctor was sitting next to me. He just said, "You guys going to replace me?" So, but the fact is, the way we need to look at this, it is going to complement them. So they're going to review it. It is going to complement them, and they're going to see more and more patients by using these tools. So in the AI, I see 5 areas. One is screening, diagnostics, treatment, operational efficiency, and it is going to make affordable healthcare. So that's the way I look at things.
Affordable and accessible as well.
Affordable and accessibility.
Absolutely.
So that's what we need to look this on actually. So I'll just share one quick use case. We have done something diabetic retina. I was sharing with him, today it's 1 out of every 5 Indian is a diabetic. Imagine to screen 40 million Indian patients, you need how many doctors? So what we did, we built a algorithm to detect diabetic. So today we don't need a doctor. A non-clinical person goes to this village, does the screening. Within a minute, the algorithm provides. So you don't need so many doctors actually. So that's the way I look at it actually.
Absolutely. I think I'll just take some last comments from the panelists before I kind of then open the floor to the audience to ask some questions as well.
Yeah, I'll just give one more example of how AI can be used not only to reduce the cost, but also to improve the efficiency. So we all know that breast cancer is becoming more and more prevalent these days, and we need very expensive equipment to do the screening also. but now we have AI-based, thermal screening-based solutions, which can do at a much lower cost and much faster, and you don't need, like extremely talented resources to detect that. So with the use of software, with the use of right technology, this can prevent lot of these questions about reachability, accessibility, cost, and all of that. So yes, AI is very much here to help us, and but HI, the human intelligence, have to use AI to do a better job at it. AI by itself won't be able to do that.
Yeah, I can extend this project. It is a very successful project in India. That thermal scanning bra is available in the market right now. So the ASA worker, they can move to a village and they can see the clinical history. If the clinical history is somewhere, it is doubtful, in that cases, they can ask to the lady to use this bra and come up. And from there, after scanning it, the ASA worker can transfer the data to her mobile, then transmit to the cloud. And there the AI model is there, and they can give the reports on it. And it is a very successful model. It is used in Punjab and Karnataka, then Tamil Nadu, already it is there. And this product is in the commercial stage. It is coming out very soon.
Yes, sir.
Answer to your question is that whether AI or Gen AI is going to replace the clinician is no. I can give you the example. If you put the AI and if you start using the AI for calculating the platelet count into the blood, we have experienced that if you are using it for platelet count, it ignores the number of the cells. So pathologist has to apply their human brain to make sure that whether it is a 1 cell or it is a 4 cells. So human brains or the clinicians are not going to be replaced in any case, be it AI, Gen AI or anything. So far as the Gen AI hype in the IT world is concerned, is that your data has to be localized across the regions. Otherwise, your Gen AI is going to reflect wrong answers. If you put pilot onto the Google, it will throw the answer is the men. If he'll say that he is the pilot, it will not be the she is the pilot. So you need to make sure.
Bias is what you're talking about.
Yeah, no, I'm talking about the Gen AI data, because you need to localize the data. So until unless you make sure that data is localized, your Gen AI and AI will reflect accordingly the answers. That's the one thing. And second, the first answer was that you cannot replace the human brains with the AI or GI, because that is based at the end of the day based upon our experience and our data.
Yeah, I think I agree with all the panelists. I mean, if you go far back, the way the technologies have been coming up, while it is impacting the traditional jobs in one way, but it was also creating new jobs in a way that is more meaningful for the person doing it and for the patients at large. Just before this session, I was sitting here and actually going through all the presentations which were happening in the Medtech area. I could see that a good amount of AI and ML is being used to actually change the way traditionally the diagnostics are being performed. We live in an evidence-based medicine era, right? It's this report that tells the clinician what is the next course of the treatment that's going to take place. So that from that point of view, I think it is akin to how a BSNL phone was back in 90s. Late 80s, it was very difficult to get the line, and then the mobile came in, and it sort of given the independence to everybody, and everybody got it. So there wasn't much of a push in terms of selling the mobile to Indians. I don't think there's going to be much of a push to sell machine learning and AI-based capabilities to, particularly in the field of healthcare, because it needs solutions. It needs a lot of intervention in terms of making the healthcare affordable, faster, and saving lives on so many levels. So this is what I strongly believe, that while it will have a initial hiccups in terms of its adoption, its accuracy, some would say that it is delusion, some would say that it is it's always answers and so on and so forth. But I think 7 years down the line, we may not be learning, but machines are learning, and learning at the pace which has a potential to sort of replace the human collective intelligence to a certain extent. But what will be more meaningful is this narrow AIs with its implications and use case across the industries that will define and change the way we've been living our life. So I'm hopeful for that.
Yeah, I agree. I think we're living in very exciting times today.
I can one point I give you. Today's days, whatever model it is there, who has approved it? Is it biased or not? Who will know it? So biased model might be there also, you do not know. And that biased model, the biased might be a 0.1%, it may be. So that we have to be more careful, and regularity has come up. The government is already trying in the health sector also. Already one task force is there in the Ministry of Health. 7 people are there. They are working on it. Yeah.
Yeah, I'm sure that there have to be great strides to be taken for the new technologies to mature. But we are in a very, very exciting time now, and the pace of innovation is accelerating, and no one has seen that kind of pace before. So I think thank you all panelists for all your insights that you have provided. I think it was a very, very engrossing, detailed session on the various technology aspects in the healthcare space. If we can have 2 minutes more, I think we can open the floor up for anyone who has any questions for the panelists. Yes, I think there is a question there.
Yeah, thank you. I appreciate having a very insightful discussion and very good moderation. In the changing time, where the focus is on context and the cognition, and the problem remains reduction of medical errors. Where do you think we should be looking at it, at the strategy or the execution? Is it okay?
Arun, do you want to take a stab at this?
Could you repeat the last one though?
I said in the changing times, where the focus is on context and the cognition, the problem remains reduction in medical errors. Where it should be looked into, the strategy, because you are all wonderful CIOs, where it should be looked into, the strategy or the execution?
Education of the clinical caregivers?
No, generally where we should be looking into for reduction of medical errors, into our strategy or into our execution.
Yeah. So
we took the problems from multifolds, cyber security and all the things. But the actual problem in hospitals remains reduction in medical errors. So where it should be looked into? Into our strategy or into our execution?
So strategy and execution will be the secondary part. I would say that we need to make sure that our data we get corrected, because the data refinement is the best policy to reduce the medical errors or the clinical errors, because based upon the refined data you would be having a better clinical decisions. If you have a wrong data, you will be having a wrong decision support system. So you have a correct data, you will be having a correct clinical decision support system. With that, you will be able to reduce the clinical errors.
And just to add on top of it, sir, errors are decreasing. Now more predictions are happening through AI. If you see in the past, we don't have a prediction mechanism. Today we have so much of prediction through AI and all these things. So able to predict the diseases much early. So in that way, improving the errors actually, decreasing the errors. That's what we see now.
One more thing I'm adding at this point. Error means the doctor is making the error. Are you? Is it? Yeah. Huh?
Errors on the outcome.
Yeah, errors is the outcome. No, errors is the outcome of, see, yeah. Arun, what he was saying that if data is not correct, it is one point of things. Okay, what it happens, when you do a test and that lab is not properly means NABL compliance and they are giving the reports, it may be wrong. But that things, it has to be done in different levels. We are talking about what you are talking about, the attitudes. Attitudes supposed to be there with the top management. But errors, what it comes, I'm talking about it. Doctors do not want to make errors. Try to understand in this way. But where the data is not in proper format or missing the data, in that cases errors has come up. Let's take, you are treating two different doctors. And you are showing that one doctor's report and other doctor's report, you are not showing it. You have a hypertension and you are taking a medicine which is thinning your blood. Somewhere you have a bleeding. Okay, and they are taking another medication. It is medical errors. Because data is available and if it is visualized in proper way, technology is there, you can visualize this kind of medication is going on right now. These medications are required to be done, how to be done, that has to be planned out. So you have a strong EMR, it is integrated and data is accurate. In that cases, medical error will go down. And simultaneously is facing by the US, 5 lakhs people die in a year on a medical errors only.
Answer to your question is there are tools available. We are using those tools to make sure that clinical errors are reducing. We have drug-to-drug interaction softwares available in the hospitals, which is making sure that clinicians are prescribing appropriate medicines to the patients. And they are evaluating, and there are tools and applications available which analyzes the patient history based upon the clinician's current prescriptions and so far interaction between the two situations, and gives the suggestion to the clinician. Based upon that, clinical errors are reducing, and that's how we are trying to reduce the clinical errors, be it into the hospital or into the laboratories. These type of tools are available to reduce the errors.
So just one last point, I think, before we end. So when you talk about clinical errors, so there are two kinds. Obviously one is the prescription kind of thing, and second could be administration errors also, right? So you ordered the right medication, but what got administered is different. So the drug-to-drug interaction kind of decision making tools will prevent the first one. And if you have scanning-based solution for administration, that will prevent the second one also. So there are, in the US, you have this 5-hour checking for every single administration, in right patient, right route, right time, right dosage, right drug. So these 5 hours have to be checked before you administer. So obviously, in India, it's not always possible given our other constraints of the time and the resources required for all of that. But technology is there. But then end of the day, it's the balance. And like you rightly said, the strategy and the execution have to both go hand in hand.
End of the day, data entry and data output, no? The in and output has to, the in has to be correct, then only the output will correct. If instead of Chablani, it is Dablani, is gone, no? As you write C, it can be D also. So input and output depends. So when you put the input, the correct is, so that CIO can't do anything. Yes.
Yeah, so I just, it was a very interesting discussion. So being an AI guy all my life, I have very, point that I wanted to understand, like, what is happening today is that, it's very clear, the AI era is going to be much bigger than internet era we have seen so far, okay? And what I have seen at least, and what we can foresee is AI computing becomes a very important thing. So we have like multiple layers as like AI stack. You have a computing resources, and then the apps that comes and sits on top of it. So my question is like, what they are being eminent COIs in eminent hospitals, what do you see like in terms of AI computings? What do you want to equip with, and what kind of applications you want to equip? I know it's a very broad question, but just wanted to just get a one-liner from you guys, like how you can happen.
See, AI implementation is all across the hospital operations. If you talk about the AI implementation into the hospital environment, right from the patient's admission till the discharge, laboratory testing, clinical consultation, all aspects, everywhere you can use the AI. So, as Praveen was saying about admission, the appropriate admission of the patient, how to direct them to the appropriate clinicians, because patient comes to the hospital with, they say that I have some problem into the spine, I have a pain into the spine, but they think that they need to meet to the orthopedician, wherein they should be meeting to the neurosurgeon. So those type of AI interventions are being used into the respective hospitals in the admission level, at the clinician consultation level, clinical decision support system applications are being used to facilitate the clinicians to take appropriate decisions. He rightly said that if medicines have been prescribed to the patient and he is going to the pharmacy and pharmacist is giving a wrong medicine, so that is also being used, correlated by the barcodes and QR codes on the prescription, so that right medicine has been given to the pharmacist, to the patient. So at every level, AI can be used in the hospital environment to improve the efficiency, to reduce the error, to improve the patient satisfaction and the clinical decision.
I just add one more point. I think in addition to that, in diagnostics also, there is a huge scope of AI. The pace at which it is finding the patterns and quickly returning the response, that is what is going to come as we move along. Probably this area will get impacted the most.
Well, I'm sure that technology in healthcare is a very, very interesting topic, and there'll be several more questions, but unfortunately there's no technology for constraining or expanding time, and we are out of that, unfortunately. So I'm sure the panelists will be around for some more time after this discussion as well. So if anyone has any more questions, please do walk up to them, and I'm sure they'll be more than happy to kind of discuss with you on some of the areas that you still have doubts or questions about. I think I'll like to call this session to an end and thank all the panelists for their insightful points of views that they've placed today in front of you, and I hope that you take away something from this meeting and be as excited as I am towards the future of technology in healthcare. Thank you all.
Thank you, Prashant. As Prashant rightly said, the future of healthcare with digital. Now it is very clear that doctors and the CIOs have to work together, whether they sit together or not, but end of the day they have to go together. Otherwise, all these kind of errors will happen. And it's very clear now the AI is part of the health, and whether we like it or not, whether it is ethical AI or non-ethical AI, we can deliberate in later, but we need AI in our life, which is going to come in. Having said that, ladies and gentlemen, we come to the end of the conference. I would like to thank all the panelists. We have the brains of the Delhi, you can call it, all the CIOs here. Give them a big hand. They are the people who are running this hospital in this Delhi, from Gangaram, Artemis, AIMS, and we have all that, and the Path Lab people and everybody. So thank you to each one of you. Before I break it for dinner and cocktails, I request Prashant to present the mementos to Sri Arun Goel. He is the Director and CIO for Sir Gangaram Hospital. Thank you, sir. Thank you. Lovely session. Lovely session. Praveen Bist, CIO Amrita Hospital. Praveen sir, insight. So thank you very much for sharing the insight on the AI. Pushkal Mishra ji, the Chief Information Security Officer of Dr. Lal Path Labs. The upcoming CIO, the young CIO from the industry. Sri Srinivasulu Tayyam CTO, Arvind Eye Care System. I've been told this is the biggest hospital in the eye care, right? Yes. Thank you. And I would like to present a memento to Prashant. You know, we talk about digital, my team is also digital. They said, sir, already de diya humne. So I would like to, I'll take 2 minutes, please sit. We have excellent partners on this first conference, you know. I would like to present a moment to all our partners. To start with, I request Father George PA, if he's here, please come on the stage to receive the memento. I request Sri Arun Goyalji, Director CIO, to present this memento to Father George, the Director of Holy Family Hospital. Thank you, sir. I'll request Mr. Praveen B, CIO Amrita Hospital, to present the memento to the partner Norden. I request Prashant to come on the stage. Anybody is here from Stemz? Stemz? No. Shivam? You're there, okay. I request Mr. Dr. Sushil Kumar Meher to present the memento to the Shivam Medicos, Shivam Medisoft Services. Thank you, sir. Thank you, sir. Now I request again to Mr. Arun Goyal to present the memento to DeAsh. May I request someone from DeAsh to come on the stage, please? Thank you so much to be partner in this. I request Pushkal Mishra, the CIO of Dr. Lal Path Lab, to present a memento to TechSpire. Gopal Joshi, yeah. They all are our partners in this event. You know, without them, it's impossible to organize such conferences. STPI from Medtech. I request someone from STPI to come over. No one from STPI? Meditech from team? From startups? No one from STPI? Okay. Janitri, anyone from? Yes, please come on. Please come. Please come. I request Dr. Amitabh to come on stage to present this memento. Dr. Amitabh is the cardiology head and HOD of Holy Family Hospital. I request Prashant Singh, Senior Associate, to present a memento to LMES Techno Consultancy. I request Rajesh Toll to come on the stage. This is the helping to all the startups in medicals. So Rajesh Kaul helps with Gajendra and the team. Yeah. So I called now. I request anyone from Agatsa. I'll request Srinivas Lu to present a memento to Madam. Aikenist. Yes, please come on the stage. I request Mr. Arun Goyal to present a memento to him also. Then Swaasa. Swaasa, please come on the stage. Someone from Swaasa. I request Dr. Vikas to come on the stage to present this memento. Swaasa. Dr. Vikas is from Holy Family Hospital Cardiology team. Anyone from ORT is here? No. The STPI, please come over. The startups, they said they are here. STPI. I request Prashant to present this memento to STPI, you are the partner, no? And Father Brito from RUPCHA, the Executive Director of the RUPCHA. Ladies and gentlemen, give him a big hand because the RUPCHA full support, we got it for this organized. Please come on the stage. I request Shri Praveen Besji to present this memento. RUPCHA is an association of all the Christian hospitals in Northeast, in the North. Thank you so much. Thank you. So, ladies and gentlemen, we come to the taxpayer दे दिया ना? हाँ, गोपाल जोशी आया ना? You didn't come? He got? He is worried about Gopal Joshi. Okay, so thank you, ladies and gentlemen. We come to the end of this conference, and it went on well. The first digital conference, as I said, that UNICEF and IIT Mumbai has started a course for all the healthcare people to start for their digital health course. They started IIT Mumbai with UNICEF. Last week only they inaugurated this syllabus. Those who want to be part of it, they wanted to be part of this event, but I'm sure they will be there the next year. So ladies and gentlemen, without taking much of a time, please enjoy the cocktails and dinner and have a networking and discuss about what all you want to talk about the digital healthcare. End of the day, providing the healthcare is very important, and affordable healthcare. Again, I put, underline affordable healthcare. Thank you so much. Give it to Sunil.